everyone, and thank you for tuning in today. I'm Dr. Thassanawut Dhearapanya, Director of Clinical Development, Bumrungrad International Hospital. Today, we are so fortunate to have Dr. Wichan Kanchanatawan, Chief of Sports Medicine and Joint Center, Bumrungrad International Hospital with us. He's an expert in the injury that can happen to the golfers like you. Golf is a beloved pastime for millions of people around the world. But as any sport, it can lead to the injury during, before, or after you play. So today, Dr. Wichan will tell you whether the injury is serious or not, or what to look for in order to prevent those serious injuries. So one of the most common golf injuries is a strain or sprain in the lower back. What are the symptoms and how do we know when you need to see a doctor?
Well, one of the most common that I got patient is a lower back pain because it's straightforward that golf is a sport that you need to turn, allow repetitive turn. So the core muscle of the back is a huge muscle mass. It's got injury easy. Especially most of the time it's from people who like large to pay. You don't get enough time to warm up. So maybe it's a good idea like you perform a few minutes, like 5 to 10 minutes stretching, light swing before you go to the real hit. So this is very helpful.
So it's a good idea to arrive at the golf course maybe 5 to 10 minutes earlier.
Yeah, get earlier. Most of the golfers will not going to do that. All right. Sometimes more serious injury can occur.
So what's the more serious injury that
Yeah,
can be
I think
expected?
everybody knows about like ruptured disc, herniated disc of the lower back.
Sure.
Sometimes it gets more serious, but it's quite different in terms of pain and like a disable you got. If you got some kind like a disc herniation, disc rupture, it's gonna acute serious pain that you might not play anymore. Yeah. So
it's a sudden sharp shooting pain.
Yeah, maybe it's very common if you turn too fast, like a hit very hard, and it acute sharp shooting serious pain. Something like that. It's different from the core muscle strain. That is maybe more common.
Dull aching.
Yeah,
and
you still can keep playing.
Yeah,
okay. But if some serious injury, you might need to stop immediately.
I see.
Okay.
I see.
And anyway, the symptom and sign of the serious injury is different. I think you will know.
So if you have kind of a small amount of pain that occur from time to time and you can still, repetitively, and then you can still play, then probably it's not too serious.
Yeah,
but
actually,
if it's a pain that is sharp shooting and happen all of a sudden when you turn, then then you cannot play anymore, then probably a good idea to go to see the doctor, right?
Yes, of course. Yeah.
Thank you very much. Thank you. What about arthritis or the degeneration of the cartilage? Will that happen from golf or from any other causes?
Well, this is also one of the common presentation because sometimes golfer is people who like 60, 70 years old still keep playing. Yes, it is good for their health. But anyway, when we getting older at that age group, we have some arthritis of the lower back already. Some people what it's called like lumbar spondylosis, or sometimes like a spinal stenosis. That means actually you have the prior symptom already, like leg pain, numbness, getting along the calf, the leg and the calf.
The back of your leg down to the calf.
Yes, that you have that kind of symptom prior to play. Acute turn, repetitive turn can be more aggravate the symptom. So if you have prior symptom, but after repetitive turn, it's getting worse,
more
like
pain.
But anyway, it's like a slow progress. It's not like a sharp shooting. So that might be the key that if you get worse. you need to consult the doctor.
Okay. So you have the way to alleviate the pain and to try to slow the process of the degeneration of the joints. I see. So if the golfers have the shoulder pain, then how do they know that they need to see the doctor now?
Well, if we're talking about the rotator cuff, this is one of the most common of the shoulder pain. I can give you a trick that is very easy. Okay, let's see if I experience a shoulder pain, I want to test. You let's check yourself. Okay, grab the shoulder and try to lift it up. Some people who have serious problem, serious pain, cannot lift it, but you still can lift it. You can hold that and let another hand to press down and check. If it's produced pain, that's been the significant. Or you can have your friend just get, okay, you grab your shoulder.
Yeah, use my right hand to grab left
lift
shoulder.
It up
lift it
to
up.
this level and fight with me. You going up and go down. Yeah, it's produced pain. This means the significant that you need to see the specialist because it's highly
likely that you have
a shoulder cuff injury. That requires treatment.
Sure, thank you very much. That's very easy to do. I've heard the term golfer's elbow, doctor. So why do they call it golfer's elbow? For what reason?
Yes, okay. Elbow is one of the most common as well in among the golfer.
Sure.
Okay, actually, if you get the elbow straight, the inner pain in the inner side of the elbow we call golfer.
Okay.
But pain on the outside of the elbow, you specify, we call tennis elbow.
Okay.
Actually, both the tennis elbow and golfer elbow can happen in every people, even household who working in the house. But they prescribe this. I'm not sure.
So it happens more in the tennis player on the outer side and for the golfer on the inner side. That's what they call it.
Maybe, but actually it can happen both. Okay.
Sure.
So how to check that and how do you know that you need some treatment? Well, very easy. Okay, put his arm.
Okay.
If you suspect the tennis elbow,
which is the outside.
Yeah, which is the outside here. You turn your palm pointed it.
Okay.
Grab.
My palm facing down.
Yeah. Grab.
Make a fist.
Yeah.
And then lift the fist up.
Lift the fist up and fight with me.
Okay.
Fight.
Okay.
If it's produced pain on the outer part, that means you have tennis elbow. On the other hand,
now my palm facing down, facing up.
Palm up.
Make a fist.
Yeah,
okay.
and hold this way.
Okay.
Yeah, and fight with me. Yeah. If it's produced pain on the inner side, we call golfer elbow.
Okay.
Most of the tennis elbow and golfer elbow is noise. It's keep coming, but most of the golfer still can keep playing.
Sure.
Yeah. Anyway, some kind of conservative treatment, even the modality of injection, ultrasound or gentle massage can help.
Okay.
So if you have this kind of annoying symptom, you can come on to specialist to get the treatment and you will have a really more happier golf playing.
Sure. Okay. So today we have so many information floating around. So some of you might grab something. I hope you can grab more than others. So if you have any problem, if you have any doubts about the pain, about the injury, or is it serious or not, then it's worth coming to have it checked. So sometimes you can check on your own, but it's always a good idea to have the expert to check on you, so you can come to our hospital. So that's all for today. There are lots of information going on. I hope you can grab some of them, if not all. And if you are in doubt or you don't know if your pain is serious or not, then it's always a good idea to come and have it checked. Coming to the hospital, having the expert to check on you, then it's always the best thing to do. You can come to our hospital or you can go to the hospital near home first. And if it's serious, then we are always ready to get referral from the first physician.
Yes, very welcome to Sport Medicine and Joint Center, Bumrungrad International Hospital. We get ready to serve you.
Thank you very much, Dr. Wichan, and
Thank you.
for